Our health is something we should never take for granted. While our lives may get busy and we sometimes put it on the back burner, there are those who simply worry each day about a roof over their heads and getting a meal to eat. They're the homeless. Well, their health and well-being is important. So students from the UCSF Fresno Medical Education Program are bringing health care to them. The students are finding they get plenty in return as well.
So you're doing good?
Matias Batista is in for her regular monthly checkup, but she's not a patient at Community Medical Center or any of the local hospitals in the valley.
Let me take a look at your eyes, okay?
Inside Fresno's Poverello House, young doctors from the University of California, San Francisco Fresno Medical Education Program are donating their time, providing medical and dental care to homeless patients at no cost.
There are a lot of people who in need of medical attention compared to the hospital that we normally work in. So we're right in the middle of the community and working in this clinic. And the patient being different and in more need of our help.
The Holy Cross Clinic is just one of the non-traditional locations here in the Valley where students who are completing their residency serve outside the four walls of a regular hospital setting. Dr. Dominic Dizon, who oversees the UCSF Community Advocacy Program, says working at the clinic and other places like it gives doctors in training the chance to make a difference in the community they will serve.
What happened this year in the Department of Medicine is that we thought that when residents stay here for 3 years and do their training, that there's not much of a connection with the Fresno community. They go to work, they go home, they rest. So this year we decided to make it a part of their training to do some kind of community service and volunteer work.
Cecilia Lamelli, a nurse practitioner, says the residents are having an impact on her as well as the patients.
I feel that I learned a lot from the residents. It's internal medicine. We have family practice residents that also come here to our clinic, and they have offered a whole new perspective on internal medicine for these chronic diseases, which is right now diabetes is what we're working with, diabetes and hypertension.
Dr. Dizon says another goal of the program is to take residents out of the sterile surroundings of a hospital and have them experience the environment their patients live in.
Here in Poverello, they actually come within an environment where most of the patients here live within the compound. So they see where they eat, they see where they sleep, where they have their habitat. And so I think there's a valuable experience that they could gain by doing this experience, by actually being the place where the patient lives.
Matias is one of the many patients who suffer from diabetes. She says she's more comfortable in the care of residents at the clinic than at a hospital because the relationship is more personal.
Me ven como de familia.
They see me as family.
Un día venía yo muy triste en Navidad.
I came here during Christmas feeling sad, and they both gave me a hug. I left feeling fine, thank God. And since then, I've been well.
You couldn't ask for a more fulfilling reason to help than that. Also, a pat on the back to Dr. Dizon, who received a Volunteerism and Community Service Award from the American College of Physicians for starting this project. Well deserved.